Social service delivery is a collection of services that are used to increase the quality of life. Agency classifications include public, private, sectarian and non-sectarian, primary and host, and for-profit and not-for-profit. Private and public are depending on their funding and policy making. The public is presented as a place where government funding is involved and state-based programs are included. The private receives donations from private affiliates, and the agency and private are voluntary. An example of public is welfare. All the funding for welfare is connected to the government. Private is food shelters. Everything with food shelters is donated to the people who get it. Sectarian and non-sectarian is another way to classify agencies. Sectarian is based on religion, and non-sectarian has no religion connected to them. Sectarian is family services. They can do all types of things for family services and push them towards, the goodness that God does for them. And non-sectarian is schools. With the diversity in schools, it's difficult to include religion because you don't want them to be influenced and then get back to home, and there would just be issues there. Primary setting is only giving social services to people who directly relate to that agency, and host settings will offer different things that help the ones that need them. A primary example is mental health. The mental health is only to help the ones who are having trouble with their mind or different things like that. And host is with schools. With schools, there can be anything from food, clothing, having a place to actual house to stay, transportation, anything like that. Non-profit focuses on services and not on the money. For-profit is a percentage of their profit goes to investors and shareholders. Non-profit would be a child abuse center or anything like that. All the work that they do is non-profit, or most of them. The one that I have worked with before was non-profit. And for-profit would be a nursing home or any type of home care. The nurses and people helping are getting paid for that. If I was an agency director, I would do, little fundraising things. I would try to reach out to the community and see what big things the community is involved in, and go from there. I would make sure that the funding and the resources and everything that I'm putting into this and the money that I'm putting into this is going to work. And so I would make sure that what I'm doing is going to produce and not fall through. That is a disadvantage, though. You never know how people are going to react to your agency, or if they're going to give, or, if people are going to show, I don't ever see an issue with asking people for money, especially for causes through social work. They say desperate times calls for desperate measures, not saying that any agency is desperate for money, but I don't think there's anything wrong with asking people for money, and it doesn't cost you anything to sit out there and ask people for money or anything like that. So that would be good. And some problems with social delivery services, or social service delivery, is that there are limited services and it allows clients to follow through. Some of them have waiting lists and they don't have enough room for them, and this can cause people to fall through and not have patience with the agency. There's really nothing that the agencies can do. They're trying their best to help as many people as they can, but sometimes it's just not enough. Services have to be effective and motivating for their clients. People who come to them are motivated in some way. Maybe someone in their family is pushing them to do well in different things, but some people who have kids or anything, they think that they're okay, they don't need to do these things. And I think as social workers, we need to involve things that motivate them to do better for themselves and for their children, or whoever is with them. I think that's a real key in social work, is being able to motivate them and make them want to better their lives. And policymakers also fail to support social planning.